We will now hear from Dr. Anshika Pathak. She is a consultant here at the Venue Naturopathy Center, specializing in holistic healthcare. She holds a bachelor's degree in naturopathy and yogic science, along with a master's in public health and a fellowship in research. With a primary focus on diabetes management, Dr. Anshika works closely with patients to address a range of health concerns. Today, she will be sharing her expert insights on diet for healthy aging and longevity. The floor is yours, Dr. Anshika. Welcome.
Thank you so much, ma'am. So to begin with, I would say Hippocrates once said, food is medicine and medicine is food. So in naturopathy, I believe that food is medicine and medicine is food. Whatever our body needs and whatever our body wants during a disease or during aging, food has answers to everything. So in naturopathy, we believe the body is made up of 5 elements: earth, water, fire, air, and ether. And any disturbances in these elements can cause disease, but aging as well. So today we'll talk about common problems in aging. That includes the heart, the joint, the blood, the brain, the bladder, and the gut. I've written care for the heart, strengthen the joints, nurture the bloods, sharpen the brain, soothe the bladder, and clean the gut. So the common diseases or the common problems, which we'll talk about: the gut health, the peripheral artery disease, which is very common in elderly, heart health, stress and depression, urinary incontinence, and diabetes mellitus, of course. To begin with heart health, I would suggest in dietary recommendations Arjun and cinnamon. The Arjun tree is rich in antioxidants and heart protective compounds, and cinnamon lowers the bad cholesterol. Together, they are a best combination. There are also scientific evidences proving it. Also for the heart, the leafy greens, the spinach, kale, and these vegetables, which are, as also told by the earlier speakers, which are very good for heart health. The berries, of course, the blueberries and strawberries, they obviously reduce the oxidative stress and inflammation. Avocado, which is very famous nowadays, is very good for lowering the bad cholesterol that we say. Olive oil is very good cooking medium, better than any other oils, as it has very high capability to take high temperatures that we use in Indian cooking. Tomatoes, which are rich in lycopene. Lycopene is also against oxidative damage, and lycopene also, tomatoes can be a good alternative blood thinners. Garlic, of course, it improves the blood flow and lowers the blood pressure. Not immediately, but if taken consistently. Next, we come for the joints. For the joint pain, elderly are mainly, with aging, joint pain comes automatically. So drumsticks, which are rich in, of course, drumsticks, methi, and gond. Drumsticks rich in calcium, methi is an anti-inflammatory, and gond, which is an edible gum, which is easily available in market. It strengthens the joint and cartilage. Turmeric also reduces inflammation and pain. It can be used with taken with warm milk and black pepper. And also turmeric with black pepper and some water can be applied directly on joints. White sesame seeds are good in calcium, and also it supports bone health. And in elderly, osteopenia is also a great problem, a big problem. And sesame seeds taken daily, half spoon, greatly helps. For joint pain, ajwain, mustard seeds, and Epsom salt. You can combine all these and make it into a small potli, and you can heat it over even in the microwave or over a skillet, and you can apply it on your joints, and it certainly helps, and it's helping. For cognitive health, which is also very common in elderly, we can use Brahmi, Ashwagandha, Shankh Pushpi, turmeric, and Ginkgo biloba and rosemary. All these herbs can be taken in combination as well, in a form of decoction made with all these herbs, and also in the form in their separate forms, and can be taken as a supplement as well. Nowadays, a lot of Brahmi and Ashwagandha, Shankh Pushpi supplements are also available. So if you don't have time, you can take these supplements as well. Brahmi, very good for teas in the morning, mixed with ashwagandha can also be taken. Ashwagandha, when combined with milk, is great for your sleep and brain functioning. Shankh Pushpi for people with memory problems. Shankh Pushpi can be mixed with water, little bit of honey can be added, and it can be taken once or twice a day. So these all herbs help greatly. Also for the cognitive health, we can take anu tel, which is a very it is made up of with a lot of herbal blends, and even you can take mustard oil and put each one drop, two drops daily in your nostril. And you can then take steam with aroma oils, which can be rosemary, peppermint, lemon, or lavender oil to soothe your nerves. The another common problem is urinary incontinence. So for people dealing with this problem, they can consume pumpkin seeds, which are rich in omega-3, and they can add it to any salads or even in any smoothies, and it greatly helps. Also, barley water, jaw ka pani, it greatly helps with urinary health, and it is a very good diuretic. Just consuming barley water can help in prostate problems in men as well. Pomegranate peel. So you can save your pomegranate peel and dry it, make it a powder, mix with the water and consume. So it will help you to tone your bladder. And for people with great urinary urgency, they can consume this twice or thrice a day in little amounts. Amla, the great amla, strengthens the pelvic muscle and promotes bladder health. The watermelon seeds. So watermelon seeds can also be dried and mixed with water like a powder. It can be made and then mixed with water. And it also, it's a diuretic and it supports the bladder function as well. Cranberries can be eaten throughout the day. And I would always recommend fresh cranberries, because the sweetened cranberries, it's not good according to my belief. Also for urinary incontinence, there is a small nuskha. So sesame and carom seeds can be roasted in a skillet, and a little bit of jaggery can be added, and you can make it like a laddu, a small sweet, and it can be consumed in the night time. And it greatly helps with people suffering with nocturia or urination at the night while sleeping. And it greatly helps. Within 2 to 3 days, you can see good results, as per my experience with my patients. Next, we come to peripheral artery disease. Peripheral artery disease is very common in adults, and we can easily help these patients with small changes in their diet. So what happens in peripheral artery disease? There's a lot of pain in the legs and in the lower limbs because of the buildup of fatty deposits in the arterial wall. And how to combat this is that you can make a simple juice with the uh, things that I've written here, which includes beetroot, that is good in nitrates, and it will improve the blood flow to the lower limbs. The cucumber, which is anti-inflammatory, and it will greatly help. Carrot also rich in antioxidants. Lemon will, of course, as rich in vitamin C, as the earlier speaker said. Ginger, Ginger also is an anti-inflammatory compound. This is a great for peripheral artery disease because it helps greatly with the circulation in lower limbs. Spinach, also rich in magnesium. Amla, that supports blood circulation. All these things, when combined together, makes a great drink for morning or as a brunch, and will greatly help in peripheral artery disease. The next thing that we come is atherosclerosis, very commonly found in the elderly people. So pomegranate, carrot, apples, lots of apples daily. An apple a day keeps the doctor away. That we say is for atherosclerosis, I must say. Lemon, ginger, turmeric, and cayenne pepper. Cayenne pepper is also in nowadays a trend in India as well. So pomegranate also you can add up in your salads or fruit bowls. And carrot, carrot is coming in season now. I think everyone who's over 50 should definitely consume carrot juices and help in their liver and reducing the bad cholesterol levels. Next, we come to the diabetes mellitus. Cinnamon, of course, cinnamon is greatly improving the blood sugar levels. You can also consume it with your regular medications. And just even if you're making rice or porridge or maybe a dalia, you can add cinnamon to it to reduce the glycemic index. And there will be certainly lesser peaks in the blood sugar levels. Bitter melon or karela, we all don't like it, but we have to know that it has a specific compound that mimics insulin, and that is the polypeptide P. It's certainly very same as insulin. So bitter melon is of course good if consumed in correct amounts. Ginseng also, it improves the insulin sensitivity. Also very good for insulin resistance. Fenugreek has also compounds that improves the insulin response, and there's certainly a blood sugar reduction. Turmeric or haldi also it's less popular, but also manages the insulin resistance and reduce the complications associated with diabetes. And tulsi, the holy plant, also if consumed in the correct way, can also reduce the blood sugar spikes and also the anxiety that comes with managing diabetes. For the gut health, which is very common also in the elderly, continuous gastric troubles and acidity that our elders face, I think some good herbs can help them greatly. So ginger, peppermint, turmeric, fennel seeds, and chamomile. Ginger can be taken just in a warm water, add some ginger, some honey, and can be taken in the morning. It also helps you to relieve, and also it's good for aggravating your hunger. For elderly who don't feel hungry, ginger certainly helps, and it improves your hunger. Peppermint can solve both mental irritability and the irritability in your gut. So it's best consumed when you're having the gastric troubles. Turmeric here as well, it supports the gut lining, and for people with ulcers specifically, turmeric greatly helps. Fennel seeds can be taken, as we all do, as a mukhwas after the food. You can have some fennel seeds, not the sugary ones, but mota sauf or the normal fennel seeds are great and a must have after you have had a good meal. Chamomile also calms the digestive tract, as well as it's also good for sleep. The main thing about constipation is water. Mainly, we are not taking water, and that is not helping. Even if we take all these herbs and all these food that I'm recommending, if we are not taking water, still constipation will persist. So it's better to keep yourself hydrated. For forget can put an alarm in their phones, and water will wholly solely water will help a lot. Trifla, as we all know, it supports the regular bowel movements. 1 spoon in the night can greatly help with warm water. Isabgol or the phylum husk acts as a natural bulk forming laxatives. For those who don't get good stools, should consume isabgol as a good fiber to form your stools. Ajwain, also known as carom seeds. Ajwain is also good when you're having stomach ache, and you can just mix it with some black salt and consume it with water. Ajwain greatly helps. Ginger, I already told you for the gastric trouble. Haritki is a very good laxative. So if there's very severe constipation, you can consume haritki also. So diet for if a person is continuously having constipation, which is very common with the patients. So I would recommend a warm, soothing bowl of khichdi for these patients with ghee. Ghee, after you cook the food, you add the ghee, not when you are cooking the food. So ghee, what it does, it soothes the gut, and the food easily travels through the intestines and the gut with the help of ghee. It lubricates the digestive tract. So warm water with ginger and fennel, they can have it throughout the day, or they can just take their water bottle, add some ginger pieces and some fennel in it, and consume it throughout the day. Also, they should avoid dry, cold, or processed foods, for example, namkeen, bhujia, or snacks. For patients with gut health, I think they should avoid all the fried foods. One more thing I would like to explain to all the elderly people is managing their nadi. It's very important. So we have two nadis. One is Chandra nadi and one is Surya nadi. You can all check it by keeping a finger under your nose and exhaling, and just check which one is working more, and then you would know how you're feeling, because emotional stress is also there in the elderly. So Chandra Nadi is very cool, and people who are not very outgoing, mostly their Chandra Nadi would be functioning, and people who are very outgoing and very, also agitation comes with the Surya Nadi if it's active more. So pranayamas like anulom vilom or alternate nostril breathing greatly helps to manage and balance your nadis. So if your Chandra nadi is working a lot more, then you can add some ginger and some spicy garlic and food with the tikshana swabhav. And when your Surya nadi is working a lot and you feel more agitated, you can add cooling food in your diet. For example, cucumbers or coconut and coconut water. Thank you, everyone. Thanks a lot.
Thank you very much, Dr. Anshika, for this very insightful expose of how we can maintain a healthy aging through elements that we can most easily find in India.